Well, I think that in our clinical investigation, clinical trials, we used to look a lot to response or toxicity as scored by the doctors. But we have to remind that the final target of our trials is the patient, and the patient needs to be, addressed in order to know which is the real feeling of the patient about the treatment and about the results. So it's important to assess patient-reported outcomes. And also it's important to make these patient-reported outcomes in an easy way for the patient. This is why there's some initiatives to develop apps to record these patient-reported outcomes at home, so the patient are more freely to express their feelings, their concerns. If they are not in front of the doctor, that they don't want to disappoint the doctor. So I think this is the major issue that we try to develop in this session.